Hi, this is Dr. Scott Hoar. Today is Treatment Tuesday, and today our special patient is Dr. Major Tallent. You've seen him before when he actually gave me a treatment. He is a chiropractor right here at Alcoa Chiropractic in Tennessee. And today, Doc, you're having some back pains, huh?
Yes.
All right, tell us a little bit about that.
Lower back on the right, getting some radicular pain into the glute, the right IT band down to the knee.
Okay. And how long have you been dealing with that sort of thing?
Off and on for over a year.
Okay.
It's gotten better, but recently it just progressed and got worse.
Okay. And what are some of the things that you feel like contribute to that issue?
Lifting pretty much anything with significant weight.
And do you have any other aspects in your history that you think are contributing factors? Like you got a knee problem, right?
Yes. Had knee surgery, and that's affected the IT band a lot into the hip.
Okay. And do you think the knee issues are contributing to your lower back issues?
Yes.
Okay, because it makes you compensate and change. Are there any other things that you feel like are contributing to additional stresses on your low back?
A new mattress.
Yeah? You need a new mattress?
No, we just got a new mattress.
Oh, you have a new mattress and you don't think that's helping?
No.
Oh, what kind of mattress is it?
I believe it's a Casper.
Okay. What is that? Is that like a memory foam thing? Mm-hmm. And is it too soft or too firm?
A little too firm, I believe.
Okay. Well, what we're going to do here is check him out, see if we can't do anything to tune up his low back and get him some movements to hopefully help him out going forward. Okay, so looking at Dr. Tallent's movement examination, we could see he definitely has some contributing factors from that knee that alter how he moves. If during movements like a squat or a lunge, he feels pain and discomfort, that tells you that his body's naturally going to compensate and alter how he moves to try to avoid the pain. And if they do that during squats and lunges, pretty much he's going to be doing that in his everyday life as he moves around, lifts stuff, and just gets things done. He's going to be compensating. And so that's going to alter the forces on his lower back and are probably contributing just like we suspected during our conversation. So what we're going to do today is get him a full treatment, see if we can't tune him up at all, and get some movements where hopefully we can kind of retrain some stability and control to his lower back and his knee to try to help him out going forward. How's your neck doing today?
Not too bad.
A little bit of restriction in the lower part. All right, let that drop right there. And a little bit higher. Very good. Okay. Big old hug. That's stiff. Keep your chin to your chest. Sit your head up. Good. All right. Good. Alright, let that go right there. Oh man. You got some stiffness. Good. Deep breath, Doc. Breathe out. Deep breath, breathe out. Okay. You said right knee? internal rotation of your left hip is definitely a little bit limited. I'm going to give you just a little mobilization there. All right, I'm going to straighten your knee. Don't let me do that. Ready? Good. Other side. Straightening your knee. Very good. Bring your knee up towards the ceiling. I'm going to push down. Resist that. Pretty good. Knee up. Pushing down. Not so good. All right, turn on your side. This side up. Face. Eyes towards the ceiling. All right. Take a deep breath. Let go. Good. Go face down. All right. Knee up towards the ceiling. Pushing down. Resist. Much better. Okay. Flip around on your back. Okay. Bend. All right, muscle test. I'm going to push down on your knee. Don't let me do that. Ready? Come on. Other side. Pushing down. All right. Turn, face. So it hurts in that position? All right.
But higher up.
Okay. All right. Deep breath. Breathe on out. Yeah. Good. Lay on your back. That's a nice reaction. Hold it right there. I'm going to push down. Don't let me. Much better. Okay. Good. Now, so this ACL was torn, reconstructed,
And
meniscus, and then it was torn again. Is that correct?
No, just torn the one time.
Just torn the one time, but you don't feel like it's been normal ever since that one surgery?
No.
Any discomfort when we lock out like that?
No.
Okay. All right, we pretty much have full flexion. And are you fully locked out there? Mm-hmm. Is it comfortable? Mm-hmm. No pain? Tell you what, flip around on your belly. Is it tender back here?
Not too bad.
Okay. Okay. I'm going to do a muscle test where I spin your foot out. Don't let me do that. Ready? It's pretty strong, really. Relax. I said we just had that pop right there. Good. I'm going to feel for his meniscus and see how it's moving as he bends and straightens his knee. A little bit of a restriction right there. With the, there's ART protocols for the meniscus, Doc, where you really feel for any restriction or sticking points as the knee bends and locks out. And you really try to get rid of any restriction. So like when we externally rotate your tibia here, it moves fine. When we internally rotate, it's not so bad actually. All right, I'm going to spin your foot out. Don't let me. Good. All right. All right. So what we're trying to do is hinge at the hip. And I call it the butt touch game. Basically, his job is to shift his butt back, tap his butt to the wall while staying neutral and protected with his spine. Go for it, Doc. And what he does is he shifts back really well, but then he kind of flexes his whole spine, loses his neutrality, and that's part of what beats up on his spine. So just go back until you tap the wall and then stand back up. Good. This time, don't touch my hand. Good. And instead of looking at the horizon, look at the floor. Don't touch my hand now. Good. And now, just do one at a time. Go about 1/8 of an inch off the wall. And you see he loses the neutrality that we're looking for. Is you go right behind you between your legs, and then you stand up. All right? The kettlebell between your legs and swing it up. Stand up as you swing it. Stand up. Too close to the ground still. Yeah. Eyes down. At the top. Good, lock out those hips. Eyes down. Look at the chair. There it is. Oh, ho, ho. Now that's a kettlebell swing. How'd that feel? Good, no pain in the low back, no pain in your knee. Could you feel yourself engaging through your butt? Mm-hmm. Good. I will say that last set you did was awesome. It looked absolutely perfect. Your knee action, your hip action, you were standing up straight and making that straight line that we're looking to make. It was looking really good. Okay, so that was our treatment today. We did some nice chiropractic work, then we did a lot of hip hinge and spinal stability training to get him to the point where he does kettlebell swings. I think it'd be a great idea for him to do kettlebell swings going forward, not only for his fitness and being in shape, but also to help out his spine and his hips. Doc, what was that whole process like for you?
It was interesting to get it all coordinated in the right motion.
How did it feel once because right at the end there, you were doing very good reps. The technique was perfect. How did it feel to kind of go from that hip hinge position to that extended position, propelling all that force without moving your spine?
You feel a lot more in the hips.
Yeah, absolutely. Hope you had a good treatment. Thank you for tuning in. This was Treatment Tuesday. Don't forget to hit the like button, hit the subscribe button, leave a comment below, and look for our next treatment Tuesday. Take care.